thanks everyone for joining us for day 2. So this panel, as Roger said, is about improving social program design and delivery. And I think it's fair to say that the premise of this panel is that a strong system of income support programs needs to be part of our nation's fight against poverty. We have some really good programs in this country, but there are ways to make them better, and that's what we're going to be talking about. Okay, and we have a tremendous panel of experts to talk about these topics. Our 3 authors are all well-regarded poverty experts. Hilary Hoynes is a professor of public policy and economics at the University of California, Berkeley. She's the co-editor of the leading journal in economics, the American Economic Review, and she specializes in the study of poverty, inequality, and the impacts of government tax and transfer programs on low-income families. Professor Hoynes' policy proposal is focused on expanding the earned income tax credit for one-child families. James Ziliak is an endowed chair in the Department of Economics at the University of Kentucky, where he's also the founding director of the Center for Poverty Research. He has published numerous articles in the areas of labor economics, poverty, food insecurity, and tax and transfer policy. Professor Ziliak's proposal is to alter the way our federal tax code treats child care payments. And third, Scott Cody is a vice president and director of human services research at Mathematica Policy Research. He's a renowned national expert on income support programs, and he's the deputy director of the What Works Clearinghouse, an initiative of the U.S. Department of Education. Mr. Cody's proposal, together with Andrew Asher, is for government agencies to improve program delivery through the adoption of predictive analytics and rapid cycle evaluation. We have 2 nationally recognized poverty experts as our discussants. Gordon Berlin is the president of MDRC, a social policy research organization that has been designing and evaluating education and social programs for over 40 years. And Bob Greenstein is the founder and president of the Center on Budget and Policy Priorities. He's a renowned expert on the federal budget and a range of domestic policy issues. Okay, to start things off, I'm going to turn to Hilary. So Hilary, there seems to be widespread agreement among both scholars and policymakers that the Earned Income Tax Credit is a well-designed program and does lots of good. So tell us what your proposal is to improving on this program and why you focus on one-child families in particular.
Excellent, thank you. Well, I suppose to start, as we shift our conversation today to talking about the social safety net, it seems fitting to start with the Earned Income Tax Credit because in focusing on children and families, it's the most important anti-poverty program in the United States. So in its current form, raises more than 6 million people out of poverty, and including more than 3 million children in that number. So it's a very important place to start. It's a hugely successful program. The hallmark of the Earned Income Tax Credit is that it's an in-work-based benefit, which means that while transferring resources to low-income families, at the same time you're providing strong incentives to enter the labor market, and decades of research has confirmed that indeed it does exactly that. It increases employment, especially of single mothers, and reduces poverty and increases income, as I started. So that's the sort of starting point, and I think it's not unimportant, aside from the policy that I'm proposing, to remind everybody who reads this amazing book how important and central the Earned Income Tax Credit is as part of our social safety net. So when I contemplated the proposal that I'm advancing today, I started from the principle that it makes sense to have benefits of the Earned Income Tax Credit sort of on par with needs across different families. And so in looking at the Earned Income Tax Credit, I quickly recognized that the schedule is more generous for larger families, particularly 2-child families and 3 or more child families, relative to the largest group of recipients, a third, 1-child families. And so I propose a sort of modest recalibration of the schedule for 1-child families to be on par with benefit schedule for 2-child families, using what we call an equivalence scale, which is implicit in the poverty schedule that we have in the United States. So that's the marker by which I compare family sizes to propose adjusting and expanding the 1-child schedule the Earned Income Tax Credit.
Let me just follow up with you for a minute, because there's been a number of proposals in recent years to tweak the EITC schedule and the way it's designed. And recently the president's drawn attention to childless workers. So how does your proposal fit into that context?
I'm glad you asked that, because I think it's important to think about what I'm proposing today as part of a broader sort of recalibration and expanding and modernizing and updating of the EITC program. So notably, my argument about having the benefits be reflecting needs across different family sizes, the biggest outlier is the very, very small credit for childless households. And in fact, there's another third of recipients are in that category. They don't earn much money. It doesn't cost a lot of the total bill, but they're a very large share of those that receive the credit. So because of the fact that there was already attention on the childless credit through the president's budget, through a previous Hamilton project, one of the early Hamilton project pieces, I thought that I would try to build on that as opposed to echoing that. And I will very much be interested in listening to Gordon, who's going to, I think, talk a little bit about some MDRC in progress activities around precisely that.
Great. Before we get to that, I want to let all the authors tell us a little bit about their proposals. So, Jim, you focus on making childcare more affordable for low-income workers. Now, our federal tax code already has a child-independent care tax credit. So, what are you proposing to do to that credit?
Basically to build on the success of the EITC. We saw in the 1990s, during the Clinton administration, the largest increase in employment rates amongst single and married women, especially those living below 200% of the poverty line. But over the last decade, those employment rates have steadily fallen, about 10 percentage points for single moms, about 7 percentage points for married moms. And what a fairly striking development is that the employment rate of married moms living below the poverty line, or even twice the poverty line, is lower today than it was in 1980. And so the idea then is trying to understand, what accounts for this decline. It wasn't just the business cycle. This is something that's been going on steadily over the last decade. And over this period, we've had stagnant wages at the lower end of the distribution in particular, or even declining. And so the idea then is to try to prop up in the same way that the EITC props up the low end of the distribution by converting the child independent care credit from the current non-refundable to a refundable credit. And in the process of doing so, target it much more effectively at low and moderate income households. So presently, the child independent care credit is uncapped, so anybody at any income level can qualify if they have qualifying child care expenses. My proposal is to make it more progressive.
Let me just interrupt you 1 second to clarify. So moving it from non-refundable to refundable, that improves the targeting. Exactly how?
Well, the targeting is going to be improved because individuals above $70,000 annual income will no longer be eligible for the credit. Okay, so the targeting to low and moderate income is to convert it from a non-refundable open-ended credit to a refundable closed-end, okay, where it ends at 70,000. And so, for example, if you take Hilary's one-child proposal, which would increase the EITC for those families to about the maximum credit to about $4,600. If you are in that phase-in range of the EITC with my proposal in conjunction, you could potentially qualify for an additional $4,000 in refundable child care credits. And the motivation for this is that presently child care is accounting for upwards of a quarter or even higher in some states of median earnings among single mother families. And so child care has become an exceptionally large burden for these low-income families. And so the idea then is to relieve some of that burden through the tax code. The proposal is to make it more generous for younger children because child care costs are higher for children under the age of 5. It's also targeted to be a little bit more generous for licensed care as opposed to unlicensed care facilities. I'm also proposing the option for an advance credit, because paying child care is akin to paying SNAP, is akin to receiving SNAP. You have to eat every month or every week, and likewise you have to pay child care every month or every week. And so there is an option to take the credit as an advance credit as well. And my belief is that, working in tandem with the EITC, that this proposal is very pro-child and pro-work.
So why do we need both the EITC and a refundable child care tax credit? Why not just do this all through the EITC?
Well, the evidence suggests that the EITC is not necessarily targeted at covering child expenses per se. A lot of times they're used for paying down debt, a down payment on some durable good, maybe a new car, washer and dryer, that type of thing. There is some evidence to suggest that the expansions of the EITC during the 1990s improved some child outcomes in terms of test scores. But by and large, the evidence suggests that, EITC is used for a lot of different purposes. And so this is a targeted credit, right, to facilitate work by virtue of supporting child care.
And presumably it would have an additional benefit of moving some kids into higher quality
That's
care.
right. And the idea of changing the level of the credit between unlicensed and licensed is to incentivize people to move from the informal care that many low-income families choose to do because that's all they can afford, to more center-based care, which is higher quality and which has also been shown to have market improvements over relative to informal care for child development. But it's important to recognize that the credit is available both for unlicensed and licensed because there are many moms have to work non-standard hours, nights, weekends, when the quality daycare centers may not be as readily available, and they too need some support.
Great. All right, so let's move on to Scott, whose proposal would be about improving the way programs like these and others are actually delivered. So Scott, first, can you define for us, in plain English, what exactly is predictive analytics and rapid cycle evaluation?
Actually, I think Bill Clinton did it yesterday when he said our proposal is, we have data, let's use it.
Yeah, there you go.
Can I stop there? No. No, so yeah, predictive analytics and rapid cycle evaluation are two tools that we think can, anti-poverty programs, a whole bunch of programs can use to help target services to clients when they need them, help identify changes to programs that make the programs more effective, and help identify changes to programs that can make them more efficient. Predictive analytics is really about using the information that we have about clients, their characteristics, their prior interactions with the system, to anticipate what kind of needs and behaviors they'll have at some point in the future. And we can use that information to make better decisions about how to serve clients. And I think a good example here is in New York City. The New York City Health and Hospitals Corporation runs the public hospitals in New York, and they serve a large number of Medicaid patients. And they use predictive analytics with their Medicaid population to identify which patients currently admitted into the hospital are at high risk of being readmitted for the same condition or a related condition at some point in the near future. And with that information, they can then develop targeted post-discharge plans for these patients at high risk of being readmitted. It's, a lot of times readmissions can be preventable. They can be caused for preventable means. So the hospital works with the patients to develop these post-discharge plans and try and prevent them from being readmitted to the hospital. This is a sort of win-win use of predictive analytics in that the patients are, the intervention helps the patients maintain their health so that they're not being readmitted into the hospital. The Medicaid program doesn't, therefore, incur the costs of what was an avoidable hospital stay. So that's an example of predictive analytics. Rapid cycle evaluation is about using rigorous research techniques to formally test changes in program operations and procedures to identify which changes make the program more effective. So this is different than implementing a change that you think is going to work and then hoping it works and then looking at the data and trying to figure out, okay, did we move the needle? This is formally testing changes in the program. And as an example here, at Mathematica, we're working with a couple of organizations right now that have voluntary services for the low-income population. And we're working with a couple of agencies, but this could apply to job training programs, to family preservation programs, financial empowerment programs, basically anything where it's a voluntary service. And the organizations we're working with struggle with low retention rates, so they really can only have an impact with this population if they interact with them repeatedly, yet more than half of the population that they serve comes in for one visit and then never returns. So we'll work with them to test, formally test different strategies to improve the retention rates. It could be very simple sort of nudge type prompts, like changing the script that the workers have, at the end of that first session with the client. It could be, personalized follow-up reminder phone calls. It could be automated text messages. It could be changes in what services are offered at that second visit. And with these tests, we'll be able to, hopefully determine which of these strategies is more effective at improving retention rates. We can compare that to the cost of the strategies and then make a better decision about what's the most cost-effective way to improve retention. And then the last thing I'll say that we talk about in the paper is, so these techniques aren't necessarily new. What's new is that the quality of data on public programs is improving, and the more data we have, the more we can use these tools. But one of the strategies we talk about in the paper is combining predictive analytics and rapid cycle evaluation. With predictive analytics, you may be able to identify which part of your population for a program is more or less likely to benefit from services. We know that our programs don't work equally effectively for all people. Using the analytics, you can identify who's least likely to benefit and then use rapid cycle evaluation to sort of test strategies for that population to try and better determine what works for whom. In the New York City example, you could envision something like this happening once the Hospitals Corporation has identified which patients are at risk of readmission. You could then test different strategies with those folks to see what is more effective at reducing readmission.
So what are you envisioning, or what are you suggesting that agencies actually do? Are they teched up enough to do this?
So right now, we think that one of the first things agencies can do is conduct a formal needs assessment, feasibility assessment.
Economics, and let me give an example of some of that work in a second. But just sticking with predictive analytics. In the 1980s, New York City worked with Jim Nickman and Beth Weitzman and others to develop an algorithm that would predict who was at risk of becoming homeless. Case closures, frequency of moves, and other things. And then we targeted a homeless prevention set of services, eviction prevention services, paying your rent, et cetera, if you were about to be evicted on those individuals, with really modest success. There was, it turned out to be really, really hard to predict accurately who was going to become homeless. And we spent a lot of money on people that had a pretty low probability of becoming homeless, but we improved it some, certainly beyond what it would have been if we hadn't done that predictive work. And then to this day, New York City works to try to refine it. Scott uses an example of some of this work on Medicaid in New York City. John Billings and Todd Mianovich developed this algorithm. We used it 5 or 6 years ago on a care management program. And it was, again, another shortcoming was discovered. Some of the people that seemed to have the most in need, as determined by the predictive analytics, were also the least likely to benefit from that particular intervention in the end. Again, it wasn't quite as accurate. So the accuracy issues, your ability to really predict, are always going to be a question, but you can narrow the band down a little bit. On the question of rapid cycle evaluation and really what it amounts to is nudging and tweaking administrative changes. Let me give an example. We're currently doing one of these projects that was really initiated by and inspired by the Department of Health and Human Services called BIAS, and it's a set of behavioral interventions. We were working with welfare agencies, we're working with child support groups. Here's one example. People who go to prison don't get their orders reduced, their arrears billed, they come out owing so much child support that they basically go underground with regard to work. The state of Texas sends a letter to them and says, why don't you apply to have your order reduced? Nobody bothers to do it. Why? Well, so we did what's called a behavioral diagnostic. The first thing was the letter is sent by the same court that locked them up. The second thing was it didn't look, the letter was written by lawyers and none of us could understand it. The third thing was it really didn't stand out in any way. It looked like a lot of the other crazy mail that inmates got. So we did a rework on all these kinds of things, and lo and behold, rapid cycle turnaround. We quickly can write the report we've just issued that says we were able to get a lot more people to apply to get their order reduced. But just stop and think about for that for a second. It is the success that Scott described. But in the long run, you also want to know whether that application was honored by that system or whether it's in fact part of a bigger problem where they're not about to reduce orders in Texas, no matter whether you apply or not. Or secondly, if they did reduce orders, how much they really go down, how much arrears you come out with, and then eventually whether or not it means you're more likely to work above the books and more likely to pay child support and support your children generally. But of course, that's not rapid cycle evaluation anymore. That's following people for several years after they leave jail to try to understand what happened. So I think it's really important to understand the trade-offs here. There's been a lot of push to do these quick turnaround kinds of things, and you can do them, and they can be valuable, and they can strengthen government effectiveness. It doesn't necessarily mean we will be accomplishing the long-term goals that we have. My last comment on this. There are many areas like this that I think we could really use to marry academics, analytics, with the management of programs. And one of the crucial areas would be caseload dynamics. If you think about homelessness, welfare, hospital stays, the caseload is a function of the rate of entry and the rate of exit and your duration while you're in there. All of these agencies ought to be collecting longitudinal data to tell them what those rates are and thinking specifically about how to manage at the front door while they're in the system and at the back door when people are leaving. So, because if you look carefully at most of these systems, 25, 30, even 50% of the people coming in the front door were there before. So I really want to praise them for raising these kinds of issues. I think there is a lot of opportunity. It's not a panacea.
Bob.
So let me mention two examples of quite positive effects from this kind of combination of analytics using the data and evaluating it. So to go back to the Internal Revenue Service and the issue, which I would say, if one is serious about trying to have a chance of doing these good policy changes in the earned income credit, we have to make more progress in reducing the error rate in the earned income credit. It is the political barrier up there. What the Internal Revenue Service does is they take a whole series of databases, child support enforcement databases and others, and they design these algorithms, and they run them to select a subset of the EITC claims filed each year. The cases that are the tax returns that are pulled as a result of the algorithms are the ones where there's a potential for a higher rate of error, and the IRS can try and check into and ask for some more information before payment. The difficulty here is the IRS doesn't have enough staff to follow up on more than a very small percentage of the cases the algorithms pick up, but nevertheless, they do get good results. And they evaluate the results, and every year or two, they modify the algorithms to make them more effective. Perhaps an example that'll excite the audience more comes out of something called the Work Support Strategies Project, which is a project in 6 states. Several foundations are funding 6 states from across the political spectrum to experiment with various kinds of mechanisms to better integrate the application and renewal processes in SNAP, Medicaid, and in some cases, child care. And it often uses these kinds of analytics. So here's an example from Idaho. So the first question was, when people are denied entry or removed from the program, because they no longer meet the eligibility criteria. The program is working as it should. But when people are denied or removed for procedural reasons, and they're still poor and in need, that's a problem. So the first thing is you go through your food stamp caseload and you look at the denial codes, and how many are eligibility denials and how many are procedural denials. So they found high rates of procedural denials, and they found them particularly high rates at renewal, when periodically you have to come back in and get renewed for your eligibility for another 6 or 12 months. So that raised the next question. Well, is there a siloed system where you have to come into the office and bring your documents to get renewed for SNAP, and 2 months later you have to perhaps take time off from work and sit for hours in the office and do it all over again for Medicaid? So they kind of looked, and they had a siloed renewal system. So this is a project that involves the states, foundation funding, Urban Institute, ourselves, and Center for Law and Social Policy. We all worked with the state, and an experiment was designed. Basically, you took the renewals in a given month, and you did half of them the old way, and you do half of them with linked eligibility, so that the documents, if you're renewed for one program, you set up the information technology sharing so you're automatically renewed for the other. You have to do it once, not twice. The results were dramatic. The rate of procedural denials dropped substantially. The rate of churning dropped substantially. People in need didn't go off for 30, 60, 90 days or even be lost for an indefinite period and come back on. So they implemented it statewide, and the take-up rates were significantly improved. I think the biggest barrier, Scott knows more than I, so I'm interested in his thoughts here, but he talks about this in the paper. The biggest barrier, I fear, is that at federal and especially at state levels in many states, they right now aren't equipped with the staff capacity, either in terms of numbers of staff or types of staff, to do these analytics and then to act on them when they get the results. And so I think that's probably one of the impediments to a wider use. But we have enough examples, I think, of positive gains that this is clearly something for the future to try to get to the point where it can be used on a wider scale.
Did you want to follow?
Yeah, I mean, I think that that's right. I think that one of the, there are a couple of barriers, and that's sort of the motivation of the paper, to making this more widespread. And some of it is data. A lot of the motivation for using predictive analytics and rapid cycle evaluation is that it's used in the private sector very effectively. I mean, the president's 2015 budget cites Capital One, which sort of famously runs tens of thousands of experiments a year, and many other organizations, many other private sector organizations run experiments very frequently. And so the expectation is we can do that in the public sector, with equal success. But some of the limitations that have been identified here are significant barriers to overcome. So data. Having the data systems that are integrated, even within IRS, having the data systems that will work and are integrated, making sure that the administrative data are high quality data, which is not an issue, is less of an issue, I would say, with public sector, point of sale data. But also, this issue of structuring the decision making within the program and who's doing the analysis and how they are interpreting it and interacting with program level decisions is actually a pretty critical issue, in that, actually to cite the private sector, when you talk to the folks who do this in the private sector, they'll tell you that, speaking of rapid cycle evaluation, they'll tell you that 70 to 90% of the things that they test fail. And that's kind of the attitude here of using rapid cycle evaluation. Let's test many things. It's, we've got administrative data, it's low cost, let's see what works. But if you're going to have that kind of attitude, you need a partnership between the people doing the analysis and the program staff, but they can't be sort of embedded in a way that they're married to different changes in the program. So there is a lot of thought that needs to go into not only having the resources to do the analysis, but how it's structured within the program.
And you have to deal with the problem. Sometimes you see the lesson, but the administrating agency says, I'm so overwhelmed as it is, because you need additional staff effort to make the change, even if the change might save you staff over time,
Yeah.
and that's another barrier.
Yeah, I mean, I think the bottom line is, to make this a reality, it's more than just number crunching. There is some real thought into data quality and administrative structure that.
So we've got a number of great questions. Before I turn to the audience questions, I want to come back to something that both Gordon and Bob raised and let Jim and Hilary weigh in. So we live in a second best world, and we're trying to do a lot through the tax code because we can't pass the spending programs we might want to pass. And one of the consequences of this is that we have trouble supporting people who aren't paying taxes or working. And both of your proposals focus on supplementing income for working individuals. So if you could step back, what's the optimal safety net? What types of programs would you have in mind?
I'll start. I think I'll make one point, and that is that it's very clear in what we've learned from analyzing the data from the Great Recession, which is our first sort of stress test of this really important dimension of the safety net, the out-of-work safety net, especially in the post-welfare reform world. It's very clear that things worked pretty well relative to how, say, poverty responded in prior recessions, appropriately compared, with one exception, and that is extreme poverty, that is defined as incomes below 50% of the poverty line, were much more volatile, much more affected in the Great Recession than what we would have predicted from historical. So I'm really just pointing out some data to support your argument, which is I think we really are at a place right now where a critical element of the safety net is broken, it's gone. AFDC CERT was always small and not very generous, but it's much smaller and less generous today. And you see fewer people in those times of need going on TANF. In fact, states that had much more severe shocks in the Great Recession didn't experience greater increases in their TANF caseload than states that had moderate shocks. In fact, many states continued to experience declines in their TANF caseload. Now, the SNAP program was the great, amazing savior for many households in the Great Recession, and the evidence shows it was very important. But I think that the place that we need to push towards, to answer your question about how we move towards a first best consolidated safety net, is to rethink what we're missing really for protecting against the most disadvantaged.
Before I kind of go to the optimal, I'd like to respond to a couple of comments that were raised by Gordon and Bob. So one concern that Gordon raised is that the policies build on a little bit of hope that moms will respond to the incentive provided through the refundable child care credit. And it's not complete just uninformed hope. That there's there's actually a very large literature estimating the effect of labor supply responses to subsidized child care. And the response shows that for every 10% cut in the price of child care, labor supply of moms responds 3 to 6%. Okay? It's not as big as the EITC effects that we've identified, but still it's non-trivial. And so it's true that the literature is not as large as the EITC, but it is actually a very well-established and high-quality research agenda. I personally have not contributed to it. Phil has actually contributed years ago to that literature. So it is there is some information behind the response that one would hope from this refundable credit. The issue of that Bob raises about the administrative burden, is there the capacity in the IRS? I think that's a great point. I mean, what I want to underscore that the advanced option is not a mandatory thing, right? It's an option, right? And so people would have the option of making it simpler, just doing it at the tax filing period. The problem is, as we've discussed, that this is a recurring expense, right? And so it's not like you can generally sign up for childcare and pay once a year. Although I guess we can't rule that out. We do it with tuition and other things like that in this country. So there is a role, I think, for the advance, but it is, I don't want to downplay at all the administrative capacity issue. I think moving more towards the optimal, I think I also agree with Bob that you would think you would want to do it on the spending side. And so you could, ramp up TANF or the Community Development Block Grant working through TANF. But I think this goes back a little bit to some of the remarks of President Clinton yesterday, and that the culture surrounding the TANF program changed dramatically after welfare reform, and that states really were incentivized to help people move from the TANF program into work. And so I think the low-income population doesn't really look to TANF as kind of a first line of defense like they did in the old days. And so I think there, to some extent, if we want to use the spending side, there would have to be a culture shift at the state and local level on what we think about TANF. Without a doubt, I agree that deep poverty has actually been a secular rise for some time in deep poverty. And this is the part of the safety net that I think we're struggling with. Some work research I did some years ago that while moms who had the skills ready to work, high school graduates or beyond, tended to do well in terms of their after-tax income after welfare reform, but the moms who are high school dropouts tended to struggle quite a bit. And so focusing more on the kind of the truly disadvantaged population, and as we think more broadly about the safety net, who's falling through that crack, I think is really important. And part of it, I think, is coming through the child care portion because in some of the work that Sendel Melanchathan, sorry, it's a tough last name, his work on scarcity, right, that one of the challenges that low-income populations face is just this scarcity of time because they're just trying to put one step in front of the other, and sometimes they can't do that. And so, and thinking about the design of the safety net under these behavioral constraints, I think is really crucial.
There's an amazing factoid here that relates to what Hilary and Jim both just said. In the late 1970s, for every 100 poor families with children, 85 received cash assistance through the old AFDC program. In 1995, for every 100 poor families with children, 68 received cash assistance through the program. Today, the figure is 26. And work by Schaefer and Eden, among others, clearly establishes a link between the collapse of cash assistance and the increase in deep poverty, as Jim was referring to.
Yeah. So here's a question from the audience, and I'm gonna read the question and then put it into a bigger debate that I'd like to raise. And the question is, what is the impact of the proposals on marginal tax rates and marriage penalties? And this gets to the point you just raised, Jim, and Hilary, we need to target programs to the most needy. But of course, when you target programs, that means you have to phase out benefits, and that leads to this unfortunate consequence that low-income folks get hit with high marginal tax rates. So now the bigger picture issue is this, of course, is the challenge to these programs. And lots of people, or a number of people in DC are now saying, well, this is the problem with these programs. They trap people down there because of the high marginal tax rates. So, so what's your response to this line of questioning?
Well, my preference is that the Congress, approve all of our proposals, including yours last fall, which basically tried to correct some of that marriage, in particular for married couples, but for more moderate income families, to try to solve some of those high marginal tax rates. Absolutely, the marginal tax rate would increase 10 percentage points for families between $25,000 and $70,000 in my proposal if you have a child under age 4. If you add that on top of the marginal tax rate of the earned income tax credit with 2 children, that's 21.6%. So yeah, it's a concern, and this is a challenge with targeting, is trying to align the incentives appropriately so that you don't ultimately kind of work against what you're trying to do.
I think there's sort of 2 related pieces of what you suggest, and that is the very fact that you have to for targeting and budgetary reasons, phase out programs, there's the issue that on the margin for people who are already in the labor market, they could be actually discouraged from working more by virtue of the fact that these high marginal tax rates are piled on top of one another. And interestingly enough, the research, at least with respect to the earned income tax credit, that tries to analyze that struggles to find an important response to those marginal tax rates. And so while we find the very strong evidence that employment goes up, it's hard to find convincing evidence that people cut their hours back or cut their earnings back in response to that phase-out region. Now, admittedly, it's a much harder problem statistically to solve, and so it's possible that we may learn more about that, but I think taken at face value for the knowledge we have, integrating that back into thinking about an optimal design aside from the political context, I think we could argue easily for more targeting and a higher phase out because the employment response is there and there's not a lot of evidence. The related question, which is part of the same phenomenon, is as it relates to the marriage penalty as well, because again, because you have to phase out a program, as incomes are combined in a world in which the family is taxed rather than the individual, of course, you have the same kinds of adverse incentives for creating married couples where there are two earners, as your and Leslie's proposal addressed in the fall. I think the evidence is also not that strong that does, if we were to get rid of those problems, would it create a lot of new marriages? And I think the evidence is not very strong that it would, but I think one could still make strong arguments from equity principles that one would want to create stronger benefits for larger families.
All right, so we have two questions, so I'll combine them on the cost of the child care tax credit proposal. So can you talk a little bit, these are some of the details in the paper that didn't come out on the panel, how you propose to pay for the refundability aspect. And then the second part of that question is whether child care tax credit changes will drive up the price of child care, much like college tuitions rise in concert with the availability of higher education grants and loans. An incidence question for you.
Yeah, great, wonderful.
We got tax people here, I love it.
You're picking the hardest questions for me, Alyssa. So the cost
of how they would use these tools, what decisions could you inform with predictive analytics? What changes to the program would you want to test with rapid cycle evaluation? And then importantly, do you have the data quality to support these types of analyses? Because these really do depend on not only having data, but having high quality data. Otherwise, you're going to make ill-informed decisions. So the rest of our proposal is really around encouraging agencies to take some steps that will facilitate these types of analytics in the future. Ensuring, and there's a lot of push for this in Washington right now, both from OMB, from the Hill, to push for data to be more accessible and more linkable across programs, because our programs serve a lot of the same people, and the more we know about people, the more, the better decisions that we can make. Another part of our proposal, yesterday Sheena said that she had the least sexy proposal, and I would like to compete with that. I think part of our proposal is to promote data governance, and I really don't think there's anything less sexy than data governance, but it's actually kind of important. Data governance is about accountability of data. Who in the agency is accountable for ensuring data quality? How is data quality measured? Who gets to make decisions about data, and those types of strategies can improve the quality of data going forward.
Great, so I'm going to turn to our discussants. So Gordon, MDRC has been evaluating safety net and work support programs for decades. So do you believe the proposals we have here on the earned income tax credit and the restructuring of the child independent care credit, do these sound like good policy to you?
Of course, they sound like good policy. I think it's really helpful to just step back for a second and ask ourselves what the problem is that we're really trying to solve. So in simple terms, it's unemployment and low earnings among single parents, persistent poverty, and diminish life chances for the children who grow up in those families. And it's really important to understand that these problems, are not just about the lingering effects of the Great Recession. They're part of a set of long-term trends that have been underway for a really long time. And getting those trends right, really understanding them, is critical to understanding what policies can really make a difference. So one good way to understand this is to remember that in the 25-year period between like 1948 and 1973, the economy was growing at 2.5% to 3% a year, and wages, earnings, and income were also growing. They were both in lockstep. It was as if the whole country was on an up escalator. And then this relationship between economic growth and growing wages and earnings and income was severed, essentially, after 1973. So a full-time male worker in 1973 was earning $41,000. Here we are all these years later, a full-time male worker in 2014 is earning about the same thing. The economy kept growing, but wages didn't keep growing. And that, it seems to me, is the fundamental problem that we have to figure out how to address. Now, there are lots of reasons for it. We don't need to get into those here. The decline of unions, the difficulty keeping the minimum wage up near, tied to the average, and lots of other activities. What's important to understand is that we need to create a new set of institutions that fit the problem in the 21st century. It doesn't mean recreating or trying to reestablish what worked in the 20th century. And that's where I think Jim and Hilary's proposals really come in. One of the crucial institutions, one of our most hopeful and potential institutions for trying to address this problem of low earnings at the low end is, in fact, the EITC and other strategies like a refundable tax credit. Now, Hilary and Jim go a step farther. Hilary's very worried about the inequities between one child and two-child families. Jim raises, several other issues. He's concerned that employment rates have fallen since 2000. He's really uncomfortable that we're spending so much money, taxpayer money, on child credits for middle and upper class families, and he'd really like to nudge mothers towards more formal kinds of care that would be likely to be more effective. I think if you start with Hilary's proposal on the EITC, she makes a very powerful case that in fact the EITC has increased employment, it has increased earnings. It's really, for both equity and efficiency reasons, a really good place to start to try to address these problems. But we have to remember that we're ignoring the safety net for those people who aren't working if we privilege, putting the $9 billion or so that it would cost here. I was fascinated by her, argument about using the equivalents and the supplemental poverty measures to try to really understand what the right amount should be. And of course, it raises the question of whether we ought to be doing that with the whole schedule and really stepping back and asking how to rationalize the schedule in a meaningful way. It raises major issues as she pointed out, if you look at the group that, makes up 25% of the population but gets by far the smallest amount, childless singles, that there's huge issues there to think about. I guess I was also really focused on how we can use this kind of strategy to step back and really think about how we would rationalize the safety net more generally. But I think of all the proposals out there, the focus of expanding the EITC in the way that she's proposed and in the context that she's proposed it, doing something about childless singles and also about second earners, as Melissa has proposed, does certainly make a lot of sense, and I think it really would respond. Jim's proposal has a harder hill to climb because it's not clear 100% what the relationship is between solving these child care problems and increases in employment, and that's really the way he's motivated his paper. I think really the fundamental problem is that childcare is pretty expensive and people don't have sufficient funds to pay for high quality care. And it's not, again, clear that the refundable tax credit is the way to get there. I think, of course, the problem is you'd want to go after that issue more directly, maybe through the existing child care funds and the TANF funds for child care programming for low-income people, so that it was very well targeted, but no one thinks that's feasible. And it seems possible that we might be able to get some movement in this area, and that would push for and argue for doing something around a refundable child care credit. But his proposal is really complicated. And in my world, if you want to change behavior, it's really important to communicate in a way that's clear and straightforward. And I think it'll be hard for at least some low-income people to really get how this would work.
Great. So before we move on to Scott's, I want to invite Bob Greenstein to comment on this. I'll pose it to you as two questions. So first, how do you see Hilary's proposal fitting in the broader debate about the future of the earned income tax credit and where we should be pushing on it?
So the case that Hilary makes for her proposal is impeccable. I mean, she clearly demonstrates in her paper that using the best equivalence scales, the level of the earned income credit for families with one child is too low relative to what we do for families with more children. She adds it to the list of desirable improvements in the earned income credit. Having said that, if you work in the political/policy world here in Washington, you often have to set priorities. And so when I read the paper, I thought, this is a terrific paper, this is a really good proposal. Where does it fit in the priority list on refundable credits? So we, in part in conjunction with Hamilton and Hilary, we ran poverty numbers, Arlak Sherman in our office. On her proposal, we've also run them on the elephant in the room in the refundable credit world, which is that there were significant improvements made in the refundable credits, both the EITC and what we call the additional child tax credit. This is the refundable component of the child tax credit. Both had significant improvements made in the 2009 Recovery Act. Those now run only through the end of 2017. They need to be, in my view, made permanent. The Obama budget proposes making them permanent. But so far, there has been no movement on that on the Hill. And it is a very big challenge. I think the odds are probably at this point politically less than 50-50 on that. So I found myself wanting to compare the two. So let me give you a few numbers. Hilary's proposal moves 410,000 people and 130,000 children out of poverty, making the 2009 improvements permanent on an annual basis, moves 1.5 million people and 800,000 children out of poverty. We also should be asking not only how many moved out of poverty, but how many made less poor. Hilary's proposal, 3 million people, 900,000 children less poor, very impressive. Making the current improvements permanent, 15 million people and 7 million children less poor. Now, to be clear, it's a more costly amount, it's bigger. But there's one additional issue. All poverty isn't the same, right? There's a difference between being at 25% of the poverty line and 95% of the poverty line. So Hilary's proposal, which is very well designed, I am not in any way suggesting the design should be any different than it is. It starts benefiting single-parent families at $9,720 a year. The things we need to make permanent help people below that as well. So I would rank number one, making permanent the current provisions that are scheduled to expire in 2017. The tougher question is the one Gordon raised. How do you prioritize the childless worker versus the one-kid families? As Hilary noted, if you want to apply an equivalence scale test, then the one that stands out the most is how tiny the credit is for single individuals and married couples without children. And there are these big issues about low labor force participation rates, particularly for young people from low-income areas starting out in the labor market. So I think for all of those reasons, I would probably put that higher as well. So that puts her proposal third on the list. Having said that, for people like myself and others who work on this, prior to this paper, we didn't have that proposal on the list.
Right.
It is now on our list. It's just that the other things are even higher on the list. Yeah. Our goal should be to get all of them. We have $1.1 trillion a year in tax expenditures. There ought to be a way in tax reform to do all these things. Right now, the political will isn't there, and we're probably going to have to go increment by increment. But in the ideal world, we do a really good tax reform, and we do all of them, including Hilary's proposal.
Great. So I just need to pause because the public finance professor in me can't help myself. But I want to make sure that everybody understands why we're focused on refundable tax credits. And it's because refundable means even if you don't owe positive taxes, you could collect the credit. And so non-refundable only applies to people with positive tax liability and necessarily doesn't hit as low-income folks. Okay, check that box. Thank you. Okay, but you know, one thing, I'll let Hilary weigh on this. But what part of my understanding of Hilary's motivation is that we actually have a lot of evidence on how the EITC incentivizes behavior and benefits family with kids, and the evidence isn't quite there yet for childless.
Right. I mean, I think that's part of where I come in and thinking about the trade-offs between the childless expansion versus the kinds of things that I'm suggesting in my proposal. And, you know, we have less evidence about what the EITC does for people without kids simply because we haven't had policy variation to explore. And so it is really quite a, in some ways, more disadvantaged population in terms of connection to the labor market and other sorts of barriers around overcoming, you know, prior incarceration and so on, that I think makes us, you know, less certain about what the labor supply effects are going to be for this population. But, you know, perhaps Gordon could tell us a little bit about what MDRC is doing that could inform that in an important way.
Okay.
So Hilary's referring to an experiment that New York City began called Paycheck Plus. And it really was an effort to experiment formally with a singles EITC expansion. It tries to address two fundamental problems. The first I've already mentioned, which is this 40-year secular decline in employment and earnings, especially among men with limited education. But the second, if you think about it, is the tax and transfer system, which by defining the deserving poor as pretty much only children, has essentially excluded singles and especially men. And so, you know, the example I like to use is if Hilary and I work alongside each other and we both make $15,000 a year and she has 2 children and I have none, at the end of the year she's going to get an extra $5,000 to $6,000. If she decides that she loves me and wants to marry me,
and doesn't pay attention to the tax consequences.
Right,
exactly.
She'll lose a big chunk of that income. Our joint income would go down. So we've created, you know, over time, not deliberately, a system which essentially distorts the incentives to work, marry, bear children, and support your children. And it's not really the way we ought to be proceeding. So the question, of course, is, so why don't we try to make work pay better for singles, in addition to the fact that they're you know, not really in the deserving poor category? Well, one reason is there's a lot of doubt about what the response would be. Would their employment responses look like the kinds of employment responses we've seen here? Would their behavior related to crime, related to marriage really change? So what have we done? We've created a singles EITC. We've enrolled 6,000 people in this formal randomized controlled trial. We phase up the EITC to a $2,000 maximum at a 30% rate. So at $7,000, you get an extra $2,000. The plateau would be you'd keep getting $2,000 until your income reached $18,000, and then we phase it down at a 7% rate. So if you look at the typical schedules, we're essentially at about, I don't know, what is it, 2/3 of what the singles credit ought to be. And if Hilary gets her way and we raise that, I'd raise the singles EITC to get back up to that equivalence level. And we're going to be tracking the two groups over time. It's being operated by the Food Bank of New York City, which is the largest VITA provider in the city. And we're using a lot of rapid cycle evaluation techniques to tweak the messaging, because people can't respond if they don't really know about it. And we hope to learn a lot more. What I worry about, just for equity reasons, not to mention American value reasons, we ought to do this as a country. We may not see the kinds of employment effects that we'd like. So it's really important to understand whether the income effects themselves and other related kinds of findings, we need to make sure that we measure those as well. So that's essentially what we're testing. And it was, I think, New York City's decision. Linda Gibbs is here, and she was essential in that process, that we really needed to address this problem. We weren't going to address it on its merits. We were going to need to have stronger evidence about the likely employment response.
One key point here, we've been talking about relative EITC amounts. Of course, the mothers with children also get the child tax credit. No such thing for the people without children. They get full food stamps. There are limitations on food stamps for single individuals without children. So as Gordon said, I mean, we don't have much of a safety net in this country. We have less than we did 25 years ago, actually, for people without children.
All right, so let me ask you to weigh in. What's your assessment of the child care tax credit proposal, both from a policy and an administrative standpoint?
So here I have a kind of a split sense. I mean, here we are today. We have, and Jim lays this out very well in his paper, we have the equivalent of an open-ended entitlement child care subsidy for upper middle and upper income people. You have a child care cost, you get the dependent care tax credit. It's effectively an entitlement through the tax code. If you're a low-income person, you don't have an entitlement. You can't get the credit. It's not refundable. You can try and get a child care subsidy through a spending program, but the spending programs are capped. And the HHS estimates are that only 1 in 6 low-income families eligible for this and with child care costs get the subsidy. Jim's proposal squarely addresses these problems. So what's my hesitation? The hesitation, sadly, is it's not clear that a key part of his proposal can be at the present time administered by the Internal Revenue Service. So he designs the proposal rightly so that the subsidy would come each month. I mean, if you have to meet monthly child care costs, simply, as in the case of the EITC, getting a big lump at the end of the year on April 15th doesn't help you each month meet the child care costs. So he has a mechanism to try to do that. We only have one other place where we're trying to do anything like this, to have a tax credit provided in advance each month for a specific expense, and it is the premium tax credits under the Affordable Care Act. We will next spring go through for the first time a tax reconciliation where a bunch of people are going to find, because their income changed during the year, that all of a sudden they have to write checks back to the Internal Revenue Service. We'll have to see how that plays out. But there's a fundamental difference between the Affordable Care Act's advanced premium tax credits and the proposal in Jim's paper for reasons that there's no way Jim could get around, and it's this. I actually was talking about this last night to a current Treasury tax official, and earlier in the day, someone in the audience who's a former senior Treasury tax official. And they both basically were pointing out the same thing, that you have to have a mechanism to avoid people owing large amounts back. And Jim does some things to mitigate the problem, but you need a mechanism where during the course of the year, there's a way to report, my income rose, I got a much bigger job, the kid is with the other parent, I've moved to a different child care center that isn't licensed or is licensed. In the Affordable Care Act, there's a third party that does that. You report through the health insurance exchange. The exchange then gets the advanced premium credit adjusted accordingly. In the case of child care, there's no third-party mechanism. You can't ask the thousands of little daycare centers across the country to play the role that the health insurance exchanges play here. The IRS is going to absolutely say they can't do it. So we have a real challenge on how would you make that work. I drew a few lessons from that. Number one, If you'll let me express a little outrage, I am really tired of members of Congress saying we can't do any of these things and we can't expand the earned income credit either because the error rates are too high, while they keep cutting the IRS budget so the IRS doesn't have the resources to address it. And the House cut the IRS budget further yesterday in the new appropriations bill. But that's a problem. Secondly, hopefully we'll learn things from the Affordable Care Act and maybe we can figure some things out over time. But the lesson it really elevates is child care subsidies with an incentive for higher quality licensed centers, what Jim is trying to do. This is really something to do it right. You need to do it through a spending program, not try to do it through an advanced tax credit. But politically, we can't do that. I mean, this is a clear illustration of the insanity of the division we have politically. Anything on the tax side, good. Anything on the spending side, bad. Tax expenditures are spending subsidies through the tax code, right?
That was a secret.
And we're going to have difficulty. We're going to have difficulty really adequately addressing the issues Jim tried to address until we either can overcome the artificial division between tax expenditures and spending on the spending side of the budget, or IRS is given really big infusions of resources to completely revamp its computer systems, do all kinds of modernization, and many more staff. Sadly, right now, neither of those seem on the political horizon.
Okay, but so that means we need better agency service delivery to implement good policy, which is a great segue to our next proposal. So, Gordon, your organization places a large emphasis on evidence-based. So predictive analytics, rapid cycle evaluation, they sound great. Do we have evidence that they work?
Oh, that's a good question. I think in general, the bottom line is that it would be good if government agencies did more of this, but I think we have to be, practical about what the long-term likely outcome would be. On the predictive side, academics and government agencies have been doing a lot of this work for a reasonably long time, not as much, I think, as Scott thinks they should, and I agree with him, but they have been doing it. And on the rapid cycle side, using administrative records, looking at that data, earlier, is also something. Even the original welfare to work studies relied on administrative data, issued interim reports that were reasonably quick turnaround. The next generation has really been driven by the push towards behavior.
The 5-year cost right now of the current child independent care credit from the Joint Committee on Taxation is about $18 billion, okay, under the current non-refundable. And again, as we've discussed, this is kind of an open-ended credit. It's not capped in terms of income. And so the expenditure on that credit is going to move from the high end to the low end of the income distribution. I've not done a simulation to kind of cost out the total amount of this proposal, but I actually think that it has a pretty reasonable chance of being revenue neutral because of the behavioral response on labor supply margin, that there'll be more people into the labor force, working more hours, which would offset some of the revenue loss from the tax expenditure. This is a little bit closer to an uninformed hope in terms of the cost part. Unlike Bob, I don't have my own simulation model, so I can't do that. The incidence, that's a great question. Of what might happen to the cost of child care through the form of the subsidy. There is some evidence to suggest that firms are cutting before tax wages in response to the EITC. So I don't think you can walk away saying that child care providers would walk away from the child care subsidy without raising prices. But it's the case that the increased income that low-income families get from the EITC, once you combine it with their earnings, right, leaves them much better off, okay, even though firms might be reacting into the presence. And I think likewise you would see, while the price of child care might go up, the subsidy at the end of the day will leave them much better off. Yeah.
Okay, so one for you, Scott.
If this is a tax question, can Jim answer?
I'll punt it to Hilary.
How can service providers convince funders both public and private, to support continuous improvement practices like predictive analytics and rapid cycle evaluation?
That's a good question. I mean, I think part of it is around, identifying quick wins, which can be difficult when we're talking about things that, as the commenters have identified, there's some real challenges here, and we're talking about, running tests on things that we're testing because we expect some things will fail. So identifying the quick wins, really being able to point to the quick wins is one strategy. But also, I think that there's, in talking with folks in state government, they're sort of prioritizing what I would call program integrity uses of particularly predictive analytics, where you can use these tools to identify ways to make sure benefits are going to the right people, and there's a sort of a savings an identified savings associated with the tools, and that kind of opens the door to investing in data, investing in systems to use them for program integrity can then open the door to using these tools and make sure you have the data to use them for other ways.
Great. So we have 30 seconds left, so I'll give you all a chance for a final concluding thought you want to share. No, we fixed it. Okay, so I'm going to take I'm going to take 45 seconds because I do want this crowd to weigh in on one thing. So there are people in this town who think that the war on poverty failed, and that programs have not helped the poverty situation in the U.S. What's your view on that claim?
Demonstrably false. Seriously.
Yes.
You look at the claim that it failed is largely based on a misuse of poverty data, where people take the official poverty rate and they say it's the same today as it was when the war on poverty started. But the official poverty rate only measures cash income. So it counts cash welfare, which has been sharply reduced since that period, both for single individuals largely eliminated and for families with kids, as we've talked about. And it fails to count almost all the major things that have expanded. It doesn't count food stamps. It doesn't count the earned income credit. It doesn't count Section 8 vouchers. So analysts across the political spectrum, I think, largely agree that a better measure of poverty is a more comprehensive one that counts those things. And the important research that came out of Columbia University in December, where they did an apples-to-apples comparison, an equivalent comprehensive measure going back to the late 60s, actually found significant reductions in poverty between the late 60s and the present when you use a consistent comprehensive measure.
Gordon?
So I would just add to that what really failed is the economy. I mean, this is a huge issue, and we have to be willing to take it on. The simple fact is that economic growth is no longer going to the lower middle and the bottom. And if you think about the war on poverty, it had at least 3 legs on that stool. And the most important, the most powerful, was economic growth. Everything else was in the service of that. Human capital investments to help you take advantage of it. And on the other side, income supports while you were getting the human capital investments to take advantage of it. That was the theory of action behind the war on poverty. That fundamental stool, economic growth, was pulled out from under. And that's why that stool is tipping over.
All right. Let's thank our authors.